my cardiologist in St. Maarten came up with the idea based on tests made during a couple of years, and noticing that the heart function was deteriorating or decreasing, she decided to have a pacemaker implanted, and specifically in Cayman Islands, in the Health City Institute.
The fact that I could talk to Dr. Ravi, I'm very impressed about how he's working and how it is able to discuss cases with him, and especially when they are, well, not clear-cut cases. So brainstorming with Dr. Ravi is absolutely fabulous. So that's why we bring the patients here, and sometimes it's not needed to bring the patients here, because we have just discussed before, and that's a great thing, the communication.
We finally managed to come to a conclusion that Mr. Essed may not require a cardiac resynchronization therapy because his heart function is pretty reasonable. However, his ECG abnormality suggests that he may be at a risk of developing intermittent heart block, which can be pretty dangerous, especially when you are on an island with a limited acute tertiary medical care. So taking all these into consideration, and after discussing with the judge, we put him on a pacemaker as a backup in case this ever happens, this intermittent heart block. He was very pleased with the fact that we did the right thing, and after including him in the decision making, we did not unnecessarily put him on a complex pacemaker, which he might not have required.
I trusted my doctor 100%, and I also saw information on the internet, and I must say, very impressive. So I said, going to Cayman Islands, to the Health City, will be the solution for me.
This is a condition where we call it as a prophylactic pacing. You are pacing, anticipating a potential problem. It's not that he actually developed the problem and you are taking care of it. So this is something like a primary prevention. Like you reduce your cholesterol in your diet to prevent a heart attack, whether you have a heart attack or not. So it's something like a primary prevention. So there are no clear guidelines for this, but we looked at the total clinical picture of the patient, and we had long discussions on this matter, and then included the patient in the decision making.
The personnel around the procedure is very good. There are anesthesists, there are technical persons and measuring the pacemaker, the cardiac surgeon, and Dr. Ravi himself. I saw it was such a good, smooth working together as a team. So yes, I was impressed, and that's why I wanted to be there, because you can understand for how things work, and also with a doctor who is good, but to feel it. And I mean, I know how you implant a pacemaker, but to feel and see how the cooperation with the team is, that's good. I think that there are some procedures we will never going to do in St. Maarten. So for that, it is good to have a good contact with a hospital who can do all these procedures.
No, I must say I should recommend this institution to everyone, wherever in the world, who need it or who might need some medical attention, especially in this field.
We have earlier managed some patients of St. Maarten with great success and with fantastic outcomes at a much lower cost to the insurance company. So I guess that has provoked the continued inflow of patients from these islands.